Do you see my presentation slides?
Yes, I can see the slide here.
Okay, that's good.
Thank you.
Hi, good afternoon. My name is Hua Yang, CEO from the Visualization Department. I'm also a director of Institute for Applied Creativity. Today, I'd like to talk about interactive, immersive applications I've worked on, focusing on medical and nursing education. My work will be more like a design and educational study work than so much computer graphics, but so we'll see. So today I'm gonna focus on a few projects since we have limited time. The first one, set of projects in creative anatomy. I'm gonna focus on muscle action VR, and in terms of immersive nursing program, I'm going to present Asperg VR. So pretty much virtual reality environment to support medical students and nursing students. Sorry, I just checked the chat. Nursing students, help their education, especially in the this pandemic time. So many things cannot be accessed in person, so providing similar quality of education in remote setting. So all of the the works I'm working on, I'm pretty much focusing on embodied interaction within virtual environment. So embodied interaction is really like how people understand the world and ourselves, and also interactions as well. But also it's not just about what people do, but it's really about understanding the relationship between the physical and social world, focusing on the embodied factors. And an immersive experience, pretty much like people's perception of being physically present in a non-physical world. So I'm focusing a lot on virtual reality and augmented reality too. I'd like to mention that I'm not particularly keen on specific environment, for example, virtual reality and augmented reality, but I explore different like environment within that mixed reality virtual continuum, depending on the fidelity and then budgets we have, and then also the technical limitations we have. But always I incorporate embodied interaction, how physical action will help them within those mixed reality environments. So in terms of creative anatomy, I've been working with like both faculty in vet school and dance program and visualization and computer science. We really focus on how people really learn, learn anatomy, and then also actually retain that information for a longer time. So in many cases, many anatomy education programs, they focus a lot on dissection. Dissection is known for kind of like a ideal learning environment for anatomy education, but it's probably as many of you imagine, it's pretty limited. It has to be in a very specific lab setting, and then also it has very specific time people can access, and also there is a very specific way of dissecting the cadaver, always from outside of the body, like from skin to in the bones, right? So the process is very subtractive and then deconstructive. So that means once you're done with dissection, you don't have any body, you don't have any 3D environment. I mean, 3D structure. So many times we learn 3D structure, kind of like kind of constructing 3D object. For example, clay animation, you make skeleton and put like muscles and skins on top, and then how you kind of see relationship between like objects within the space, right? But dissection process doesn't help with that process. So we, like at the beginning of this whole research, we introduced how, what kind of embodiment can be introduced within the anatomy education. We collaborate with like artists in visualization and dance program, like kind of teaching anatomy students with the drawing, painting, and clay animation. And then we kind of like got the essence of those embodiment from the artistic practices, and then applied that knowledge into virtual reality application we created. So I'd like to play this video. Hopefully it plays well. Yeah, so it has different rooms.
Welcome to the Sandbox Experimental Room. The purpose of this room is to give you free rein in practicing skeleton assembly or creating an organism of your imagination.
So in this environment, you see a little, like circular space on the floor that is anti-gravity area. So you can put any, part of the body, like 3D structure by yourself. I think one of the requests we got from the vet school and the biomedical science department faculty, they kind of wanted to have some space students can make mistakes. Because cadaver dissection, you cannot make mistake. If you make a mistake, you kind of screw up. You cannot really learn things. But within this environment, you can do things that, again, if you made a mistake, and also you can test things like, is this correct connection between like these bones, right? So it was really important for students and faculty to kind of explore their idea. Okay, this is what I learned from the cadaver dissection, and then they kind of replicate that knowledge within this environment. Okay, so let me move on to the next one. Okay, so we started with Anatomy Builder VR, and then all of those, we focus a lot on just creating, 3D, skeletons, 3D structure of the body. And also another, most challenging task for anatomy students was, like understanding, muscle movement. Because, like when you look at, just human live, then you can't really see underneath of the skin, right? So it's hard to understand, the shape of the muscles when you contracted certain part or release certain part. With the cadaver, it's already, dead and processed, so you cannot see the movement. So we incorporated, human movement with this anatomy education, and how we can really demonstrate and simulate muscle movements related to certain gesture. So we use HTC Vive and Vive trackers, put the trackers and the headset and controllers on user's body like this, and then we connected these cadavers, that kind of what we call it muscle men, with these human movements. So let me play this video. So imagine in the VR environment, the user has all the sensors on their body, and then have a headset and a controller on their hand. So it's kind of initializing their pose. So once it's initialized, and then connected with the muscle man, and then you become this muscle man, and then you can move your own body and then actually see how each muscle or the group of muscles move or react to your movements. And also, it's kind of hard to see all your own muscles from top, right? So we put a mirror. So currently the user is looking at the mirror, and then change the direction of the camera. So the without turning the user's body, they can still see the side of the body and then the back of the body. And then again, like moving their arms and legs, and see each part is activated. Especially this one, we gave a specific task, specific gesture they have to do. So they do specific motion, and then it shows specific area activating. Sorry, it's kind of jumping a little bit. Yeah, with this project, we really wanted to use the kind of like a sensors, not so expensive, off the shelf, how users easily wear without complicated, suit or something like that. So so I think in terms of that, I think that project was very successful. Still, we're having, like a challenge with, having very accurate movement with sensors. And then sensor data still not so stable. So we're working on making that movement much smoother and that makes sense to the user. Okay, now I'm going to talk about immersive nursing education projects. So we have a set of projects within this scope, immersive nursing, and we have a big collaboration with the College of Nursing and A&M. Currently, we have done some projects, for example, like Aspert VR and forensic nursing for female examination and antepartum assessment. We're currently working on a few other projects. As I mentioned before, the goal is pretty much developing virtual environment, learning environment with virtual standardized patients for specific nursing educational scenarios. So for the first project we started is Aspert. Aspert is screening, brief intervention, and referral to treatment. So this is a very specific technique, physicians or nurses use with the patients who have some behavioral health issues. For example, alcohol abuse, or so if people have some behavioral issues, they kind of like have a conversational method to find out what's going on, and then they do brief intervention and then find out like what to do next for treatment. So Aspert project, the main goal was really wanted to create some like virtual patient. We started this one before the pandemic, or maybe like early time pandemic. So again, nursing students couldn't access to standardized patient. So standardized patient, if you are not familiar with, it's more like they are like real human. They come to the classrooms, the nursing classes. They kind of act as like patients. So they're pretty much actors, part-time actors. They come to the classroom and they kind of act based on the scenario they learned. So if this is alcohol abuse scenario, behavioral thing, they kind of acting, they have some alcohol problems, but because of pandemic, it was almost impossible to invite standardized patient to the classrooms. So we really looked at, how can we, solve this problem? How can we have some computerized, virtual patient? But it was really difficult, to create a smart patient at that time. And also they really needed it, really quickly. So what we did was, okay, we are going to have a students in the VR environment. They're going to see the virtual patient, but the virtual patient was pretty much puppeteered by an instructor. Okay, so it looks like that. So nursing students in virtual reality environment, and then on the computer, the faculty or peers, can kind of like put the responses. So nursing student ask questions, and then the instructor listen to the questions, and then kind of like enter the right answers for the virtual patient, right? So the virtual patient doesn't have any intelligence at that point. So let me play the video to help you to understand. And also this environment for multi-users. So it could be multi-rooms with multiple users, multiple instructors. So this is instructor's view. Instructor click their username and choose a specific room, then choose specific scenario. Currently we have scenarios developed. And then on the student side, in VR environment, they choose the same environment, same room. So this is student's view, nursing student's view.
Hello, Pastor Zimmerman. I'm a practitioner student and I will be working with you today. So I understand that.
Sorry.
You today. So
what I wanted to say was, so in the, from the instructor's view, the instructor can see, okay, there is a nursing students here with the headset and then hand, and they can hear the nurses, what the nurses says, right? And then choose specific responses on their own interface.
I understand that you recently had a nodule removed in your throat. Is that correct?
Yes.
Okay. Do you mind just telling me a little bit more about yourself?
I've been pastoring the church for the last 25 years and I have built up a nice congregation. My wife's at home with Alzheimer's. I feel very guilty these days because I've been drinking pretty heavily and I don't want to disappoint people.
That sounds like it would be incredibly hard.
It's not an easy situation.
So it seems like you're using alcohol as a coping mechanism.
So in this case, the instructor cannot find a specific answer from our current script. They can just type as well. And also if there is a very specific instruction they want to provide to the nursing student, they can unmute themselves and just talk through microphone as well. So in this time, we focus a lot on how to implement this virtual patient kind of scenario without, utilizing AI or machine learning. And then we also, this is a different application of forensic nursing. We also use, like physical interaction, like going through this physical exam with a female victim from sexual assault. So, these are the example for the physical interactions. So the current and the future direction we're taking for digital twin, really we're focusing on how to create digital twin for virtual standardized patient. And also how to talk to the patient is really important skills nursing students have to practice and learn. So it's based on the medical history of the standardized patient, and then how to analyze, how to collect the conversations, and how to analyze and then design the conversational system, and then working on the conversational AI. And also many times, like a hospital really works, it's not just one person work. So we're trying to incorporate how multiple people, for example, like nurses and examiners and doctors, like how they can actually work together within the same virtual reality environment. So that currently we're focusing on the analysis of conversation between physician and nurses and standardized patients. I think that's it.
It's great. Thank you so much, Oyoung. So we have time for one or two quick questions. Anyone from the audience? Go ahead, unmute yourself. I saw someone just raised a hand, but hey, Lisa, go ahead.
I was clapping.
Yes.
No, I'll just add, it was a wonderful presentation. It's very exciting working with you're doing.
Sure. That's great.
Yeah,
it is.
Yeah, anybody who's interested in, knowing more about these projects, and also want to be part of the team, feel free to contact me. We have a great team to work with.